Many of us look forward to a massage as a way to relax our bodies and calm our minds. We think about soothing music, a comfortable table, the release of muscle tension. But for some, a quiet worry can creep into this picture of tranquility. It is a question people often feel too embarrassed to ask their doctors or massage therapists. Can I get a sexually transmitted infection or an STI from a massage? This fear is more common than you might think. It stems from a misunderstanding about how these infections are transmitted. The massage environment involves close personal contact, shared surfaces like the massage table and linens. Let's start with the basics. What exactly are sexually transmitted infections or STIs? The name itself gives us a very big clue. They are infections that are primarily passed from one person to another during sexual contact. This includes vaginal sex, anal sex, oral sex. These infections are caused by tiny living things like bacteria, viruses, parasites. Think of them as very small germs that can make people sick if they get inside the body. Some common examples you might have heard of are chlamydia, gonorrhea, herpes, HIV. It is helpful to think of these germs as being very specialized. Now that we know what STIs are, let's look closer at how they actually travel from one person to another. The most common way this happens is through the exchange of bodily fluids during sexual activity. This includes fluids like semen, preseminal fluid, vaginal fluids, and blood. When these fluids from an infected person come into contact with the mucous membranes of another person, the germs can get in. Another direct route of transmission is through significant skin-to-skin contact with an infected area. This is particularly true for STIs like herpes and human papillomavirus or HPV, which can cause sores or warts on the skin. Notice what is not on this list: casual contact. Things like hugging, shaking hands, sharing toilets, or using the same swimming pool do not spread STIs. The germs that cause these infections are not designed to survive the journey through the air or on dry surfaces. This is one of the most common fears people have, so let's tackle it head on. The myth, germs left behind on linens could infect you. It sounds scary, but science disagrees. Bacteria, viruses, both are fragile, not built to survive long in the open air, on a dry cotton sheet, on a vinyl massage table. They need the warm, moist environment inside the body. Think about the germ's journey: leave the infected person's body, land on the linen, survive exposure to air, changes in temperature, drying effects. Most would die in seconds or minutes. The whole chain? Practically zero chance. It's imagination, not microbiology. Therapists train in strict hygiene for this reason. Spas must change all linens between clients. Fresh, clean sheets, blankets, face cradle covers. Tables are wiped with disinfectant between sessions. This prevents hardier germs. Think skin infections, the common cold. Another common worry revolves around the skin-to-skin contact that happens during a massage. People wonder if an STI can be passed from the therapist's hands to the client, or vice versa. This concern usually comes from knowing that some STIs like herpes and HPV can be transmitted through skin contact. However, it is vital to understand the context of that transmission. As we discussed earlier, this type of spread requires direct contact with an active sore, blister, or wart. It is not something that is spread through casual touch of healthy, intact skin on the hands or back. A professional massage therapist is trained to observe contraindications, which are reasons why a massage should not be performed. An active, weeping skin lesion, herpes, a bacterial infection like impetigo, or even a bad case of poison ivy is a clear contraindication. Massage therapists wash their hands thoroughly before and after every single session. This simple act of hand washing is one of the most effective ways to remove any germs. Therefore, the risk of getting an STI through the skin-to-skin contact of a standard, professional massage is negligible to non-existent. The use of oils and lotions is a standard part of many massages designed to reduce friction and moisturize the skin. This has led some people to wonder if these products could harbor or transmit STI germs. First, let's revisit our germs. Bacteria and viruses do not fare well in massage oils or lotions. Lotions don't provide nutrients or the right environment to survive and multiply. Many lotions contain preservatives that inhibit microbial growth. Bacteria and fungi are commonly blocked by those preservatives. To avoid cross-contamination, therapists are trained to dispense properly. Pump bottles and squeeze tubes are commonly used. That keeps the product fresh and untouched. If jars or tubs are used, practitioners scoop with a clean spatula or tongue depressor. They never dip hands back into the main container after touching a client. While the risk of contracting an STI from a massage is virtually zero, that does not mean there are no health risks to consider. It is just important to focus on the real, albeit uncommon, issues. The most likely health concerns in a massage setting are related to general hygiene and sanitation. These include fungal infections like athlete's foot or ringworm, and bacterial skin infections such as staph. A key thing to watch for is the overall state of the spa or clinic. Does the space look and smell clean? Pay attention to the massage room itself. Linens should be visibly fresh for every client. Floors should be clean. There should not be any clutter or dust. Look at the equipment. Another area to be mindful of is the qualification of your therapist. A licensed or certified massage therapist has completed extensive training not only in massage techniques but also in anatomy, physiology, and health and safety standards. They understand contraindications, the medical reasons to avoid massage, such as open wounds, certain skin conditions, fever, blood clots. Feeling confident about getting a massage comes down to choosing the right place and the right therapist. You have the power to make smart choices. First, do a little research. Look for reviews online from previous clients. Google, Yelp, specialized wellness sites. Pay attention to comments about cleanliness and professionalism. Check for credentials. Look for licenses and certifications. Ask to see them if they're not displayed. If a place seems hesitant to share this information, or if their prices seem unusually low, it could be a red flag. Investing in a qualified professional is an investment in your own health and safety. When you arrive, use your senses. Your first impression of the facility is very important. Reception area, hallways, restroom. When you are taken to the massage room, look for those key signs of hygiene we have discussed. Are the linens on the table crisp and fresh? Does the room feel tidy and sanitary? Throughout this discussion, we took a close look at the facts about STIs and massage therapy. We separated myths from medical reality. The scientific consensus is clear. You cannot get an STI from a standard professional massage. The biological requirements for transmission are intimate sexual contact and direct blood-to-blood transfer. These are not met in a therapeutic massage environment. Understanding this is the key to letting go of unnecessary anxiety. This knowledge should be empowering. It lets you shift focus from unfounded fear to what really matters, your health and well-being. The benefits of massage are well documented, reducing stress and anxiety, relieving muscle pain, improving circulation. Focus on real safety indicators like cleanliness, professional certification. Then you can confidently choose a massage practice that contributes positively to your life. Fear often comes from the unknown. Now you are armed with facts. Conversations about health should be grounded in evidence, not alarm. So go ahead, book that massage. Allow yourself to relax, release tension, reap the rewards of therapeutic touch. Don't let debunked myths rob you of this benefit. A professional massage is one of the safest things for your health. By embracing wellness and letting go of fear, you choose a happier, healthier life. Be informed, be aware, be well.